Well, I think it's fair to say the world of healthcare services has changed forever. Medix has recently entered the Australian market and aims to fast track and personalise medical solutions, from the right diagnosis to optimised treatment pathways. Founder and MD Sigal Atzmon joins us now to explain their growth and plans. Welcome to Ticker News. How are you today?
Great. Thank you for having me today. Very excited to be on.
Of course.
How are you?
Thanks for your time. Going very well. So firstly, tell us, how has the pandemic impacted the healthcare services, particularly in the APAC region with the APAC countries?
The impact has been tremendous. First of all, I think that COVID-19 has really been a wake-up call for everyone. First of all, it has put focus on unprepared healthcare systems, unprepared patients. Not enough has been put and stressed on the level of prevention. People haven't been healthy enough and well prepared. Budgets have not been focusing on healthcare, and affordability, accessibility of medical care was not at the center. This pandemic has really drawn a lot of attention to the change that is needed, the focus, the investment, and making healthcare more affordable, accessible, quality-driven, and for hospitals to be ready to take up more patients under such crisis. So I think we've seen a wake-up call, but we've seen a response as well. Different countries have responded in different ways. Clearly, vaccination numbers have not been the same. Some countries have opened or kept their borders open. Others have, like Australia, had very, very harsh lockdowns, which has not been easy for Australian people, really not been easy. So we've seen differences, but clearly in common. It was difficult, it still is. Some countries have done better, some others have done less. But I think everyone is focusing on preparedness for the next round and getting it right, really.
So you're looking to expand and move into Australia, as I mentioned. What are some of the challenges and also why Australia at the moment?
So Australia has always been a very important nation and country for us. We've been servicing Australian customers for many, many years, not with footprints and operational capabilities on the ground, which we've decided as part of our roadmap to change now. So we've recruited significant number of people on the ground, doctors, nurses, medical coordinators, trainings, medical educators, etc. We feel that Australia's demand for our services is growing, for prevention services, personal medical case management services, rehabilitation services, mental health services, and all of them are really a combination of digital health tools, which we see today as a result of the pandemic that the uptake is much more significant. We know today that 2 out of 5 Australians are using digital apps to actually access healthcare services. 70% of those who don't are willing to, based on a Medix Cantor research that was led in Australia specifically. So the demand is bigger, the appetite is bigger. Australians want on-demand services that are easily accessible in a secure way, quality-driven from the comfort and the safety of their homes. So Australia is in our hearts, but we also realize that the demand and the opportunity is huge, the needs and the gaps with a fragmented healthcare system that is not always accessible, not always easy. With the pandemic on the back, with the solutions that we've implemented in so many different countries, Australia has to be our priority. And making sure that Australians have better healthcare system, will be better prepared with better accessibility, affordability of healthcare. This is our priority, really. And we're very excited to have come to Australia. And we already have a strategic partnership with AIA Australia, providing navigation and health mentor services. So we're very excited about what's going on.
And just finally, how do you foresee the trend of personalised medical case management in Australia? How do you see that developing, just to finish, over time?
Sure. So we see the demand growing. People who have been diagnosed with a serious medical condition actually want to have someone that holds their hand and reviews from a personal level and really looking at their personal interest and making sure that the medicine that is applied is personalized and to have someone at their quarterback. So the demand for our services have grown tremendously. People would like someone to hold their hand and navigate through the system to make sure that they are diagnosed on time, that the diagnosis is correct, that all the different treatment options and clinical pathways have been presented to them, and that they can make an evidence-based, objective choice of what is the best treatment moving forward. And then they would like to have someone to support them in the coordination and the process of implementing that care. You must remember, though, that Medix does not provide actual physical treatment. We work in collaboration with the treating doctor wherever he is in Australia, and we provide access to our customers and all Australians, basically, to a network of thousands of local doctors and global doctors, over 2,500 hospitals and 300 in-house doctors and nurses that support our Australian customers through that process. We see a huge demand. We see above 70% of Australians actually responded in a research that we've done, that are keen to use, if they would be diagnosed with a serious medical condition, the personal case management. Healthcare today needs to be personalized. It needs to take the genetic, the family history, the personal data into account, use AI-driven and digital solutions, data analytics, to make sure healthcare is personalized. And that is exactly what we're bringing to the market.
Nicely done. Exciting times ahead. You'll have to keep us up to date. Sigal, thanks so much for being on Ticker News today.
Thank you very much.